If you watch television, if you read newspapers, or listen to most doctors, you will get the idea that at best, vitamin therapy needs more research. It's promising, but there's really nothing to go on. And at worst, you'll be told flat out that it's no good, that is dangerous, that it'll kill you. Well, it's time for us to stop looking to people who don't know what they're talking about and start looking at people who do. This has been my life's work. I used to tell my children, still do, I'm not better than you, I'm not smarter than you, I'm just older than you. And in that time, I've had a chance to learn from people that actually know what they're doing. Here's the story, the timeline of megavitamin therapy. I guess you could say it's about 81 years old because in 1935, Professor Klaus Washington Jungblut, a medical doctor and professor of bacteriology at Columbia University, showed that vitamin C helped to stop polio. The doses that he used were not very high, but it was so important that it was written up in Time magazine in 1939. Whatever happened to polio therapy using vitamin C? He had several other papers as well in 36 and 37, 38. In 1936, 80 years ago, Wilfred SHUTE, MD, and Evan SHUTE, MD, showed that vitamin E-rich foods, such as wheat germ oil, could cure angina. In 1939, William Kaufman, a PhD and an MD, successfully treated arthritis with niacinamide, vitamin B3. In 1940, doctors Wilfred and Evan SHUTE, remember them, published that vitamin E prevents fibroids and endometriosis. A lot of ladies are real interested in this. In 1940, vitamin E was seen to be what would prevent it. In 1942, one of the great female researchers in medical history that you might not have ever heard of, Dr. Ruth Flynn Harrell, measured the positive effect of thiamine supplementation on learning for children. Vitamin B1 is thiamine. Extra thiamine helps kids learn. In 1945, it was shown that vitamin E as an eddy would cure hemorrhages in the skin and mucous membranes and would decrease a diabetic's need for insulin. In 1946, vitamin E was shown to improve wound healing, including skin ulcers, and they're hard to heal. It was also demonstrated that vitamin E strengthens and regulates heartbeat and was effective in cases of intermittent claudication and nephritis, acute nephritis, that's a kidney infection, thrombosis, cirrhosis of the liver, phlebitis of the blood vessels. And on top of that, it was a great year. In 1946, William J. McCormick, MD of Toronto, Canada, showed how vitamin C prevents and dissolves most kidney stones. 1947, vitamin E is successfully used as therapy for gangrene, inflammation of blood vessels, retinitis, and other ailments of the eye. Dr. Roger J. Williams, that very same year, in 1947, published on how vitamins can be used to treat alcoholism. Roger J. Williams, PhD, professor of chemistry, and the man who discovered one of the B vitamins, pantothenic acid. Great scientist. Imagine, 1947, he was telling folks how to cure alcoholism with vitamins. 1948, Dr. Frederick Robert Klenner, Duke University Medical School graduate and board-certified chest physician, published cases of people cured, his patients cured of viral pneumonia using very high doses of vitamin C. In just 2 to 3 days, Klenner cured 41 cases of viral pneumonia with vitamin C in very high doses. 1949, Dr. Kaufman, remember him, the doctor who used niacinamide to cure arthritis. In 1949, Kaufman published The Common Form of Joint Dysfunction. The complete text of this rare book is online at dryourself.com. And Kaufman is Kaufman, 1 N. In 1950, vitamin E was shown to be an effective treatment for lupus, varicose veins, and effective in cases of severe body burning. It can be used topically. You don't even have to touch it to the skin. You can just drop it on. Soothing, effective. Reduces inflammation and infection. Saves lives. In 1951, way back in 51, vitamin D as in Doug was found to be effective against Hodgkin's disease, a cancer of the lymphatic system. In 1954, Dr. Abram Hoffer, MD and PhD, and his colleagues demonstrated that niacin can cure schizophrenia. That same year, Dr. William McCormick reported that cancer patients tested for vitamin C levels were seriously deficient in every case, and often as much as 4,500 milligrams in the red. In other words, they'd need 4,500 milligrams to just be out of scurvy. In 1955, niacin was first shown to lower cholesterol, specifically lowering triglycerides and LDL. It also raises HDL. 1955. 1956, the very next year, Mayo Clinic researcher William Parsons, MD, confirmed Dr. Hoffer's use of niacin to lower cholesterol. Dr. Ruth Harrell, that year, again, Dr. Ruth Flynn Harrell, demonstrated that supplementation for pregnant and lactating mothers increased the IQ of their offspring at 3 and 4 years of age. There's an interesting study. Babies get smarter because mom takes vitamins while she's pregnant and nursing them. In 1960, Dr. Abram Hoffer met Bill W., that's the Bill W., the co-founder of Alcoholics Anonymous. Dr. Hoffer treated Bill W.'s long-standing severe depression with niacin. Bill W. was impressed. 1963, vitamin D was shown to prevent breast cancer in 1963. Think about that when you buy your next ribbon to wear. Might be a good idea to tell the person selling that ribbon that they should also research vitamin D a little bit more, or maybe even look at the research that was done 50 years ago. In 1964, vitamin D was found to be effective against lymph node cancer. This is a non-Hodgkin's lymphatic cancer. In 1968, Dr. Linus Pauling published The Theoretical Basis of High-Dose Nutrient Therapy, Orthomolecular Medicine, in the journal Science, and gave orthomolecular medicine its name. Orthomolecular medicine means the right molecule, orthomolecular. That's nutritional medicine. Specifically, said Pauling, the treatment of disease by providing the optimum molecular environment, especially the optimum concentration of substances normally present in the human body, like vitamins and minerals. Drugs, on the other hand, are not normally present, with very rare exceptions. Substituting insulin if you don't have enough is certainly valid, but most drugs are toximolecular. They are foreign. The body doesn't know what to do with them. Not one cell in your body is made out of a drug. Every cell in your body is made out of a vitamin. And then in 1969, along comes Dr. Robert Fulton Cathcart III, MD, who uses really large doses, not only to treat pneumonia, but also hepatitis. And in later years, he would treat acquired immune deficiency syndrome with massive doses of vitamin C. In 1972, Dr. Irwin Stone publishes The Healing Factor, Vitamin C Against Disease. Wonderful book. And although it was published so long ago, it's an excellent review of literature up to 1972. And you can read this book free online. It's, again, The Healing Factor by Irwin Stone. And you can do a search and find it online, read it for free. In 1973, Dr. Frederick Robert Corner publishes his vitamin supplement protocol to arrest and reverse multiple sclerosis. And so does Dr. H.T. Mount, reporting on 27 years of success using thiamine. And Ewan Cameron, MD, and Linus Pauling, remember him, published their first joint paper on the control of cancer with vitamin C, 2 years after Cameron first started giving IVs of C in 1971. In 1975, Dr. Hugh Reardon, MD, and his colleagues successfully used large doses of intravenous vitamin C against cancer, building on the work of Ewan Cameron and Linus Pauling. In 1977, here's a surprise, Alfred Libby, MD, and Irwin Stone present findings that the use of high doses of vitamins hastens and eases withdrawal from highly addictive drugs, including heroin. Individuals that get massive doses of vitamins, especially vitamin C, can come off narcotics and other hard drugs with few or no withdrawal symptoms. I've taught in 2 state penitentiaries, and I know the value of what this means. In 1981, Dr. Ruth Harrell demonstrated that high doses, very high doses, of multiple nutritional supplements could help overcome learning disabilities in children. And the best part, bring about highly significant improvement to those with Down syndrome. Vitamins for Down syndrome, 1981, beautiful research by Dr. Harrell and her colleagues. If someone's told you that vitamins have no role in dealing with genetic diseases, and Down in particular, you just point them to Dr. Harrell's research. You can find it online. 1982, in Japan, researchers show that vitamin C greatly prolongs the lives of terminal cancer patients. 1984, Dr. Cathcart is now publishing on treating AIDS with vitamin C. Longer life, fewer symptoms. In fact, a lot of his AIDS patients were completely symptom-free. They still had AIDS. They still were HIV positive. They just didn't have any symptoms. And that's good. 1988, the children's doctor, Dr. Lyndon H. Smith, publishes Vitamin C as a Fundamental Medicine, which is a discussion and summary of Dr. Klenner's work. This book is now known as Clinical Guide to the Use of Vitamin C, and it too is online for free reading. Kind of takes the wind out of the sails of any reporter, politician, or doctor who says there isn't any good evidence that high doses of vitamins can cure disease. You know, if I can find this stuff, and you can too, with a simple search, your doctor should be able to find it. But don't wait until they do. You find it first, because you need to know it today. In 1990, American doctors successfully used vitamin C to treat kidney cancer. In 1993, studies show that vitamin E supplementation, that's E as in Edward, reduces risk of coronary cancer, reduces risk of coronary heart disease. And in 2002, vitamin E is shown to improve immune function in patients with advanced colon cancer. Colon cancer is very dangerous, very, very hard to treat. 2004, doctors in America and Puerto Rico published still more clinical cases of vitamin C success against cancer. 2005, the United States National Institutes of Health shows that high levels of vitamin C kills cancer cells without harming normal cells. In 2006, Canadian doctors used intravenous vitamin C to treat cancer. This is 10 years ago. 2007, Harold D. Foster and his colleagues publish a double-blind, randomized clinical trial showing that HIV-positive patients giving supplemental nutrients can delay or stop their decline into AIDS. And in 2008, Korean doctors report that intravenous vitamin C plays a crucial role in the suppression and proliferation of several types of cancer, notably melanoma. Melanoma is by far the most dangerous skin cancer. And in 2008, it was shown that natural vitamin E reduces risk of lung cancer by 61%. In 2011, it was shown that small increases in blood levels of vitamin C are associated with a reduction in death from heart failure. In fact, each small increase, 20 micromoles per liter increase in vitamin C, reduces death from heart failure by another 9%. So we could save a couple 100,000 lives a year if everybody took 500 milligrams of vitamin C a day, maybe 1,000. In 2012, vitamin C was shown to prevent and treat radiation-damaged DNA. Dr. Atsuo Yanagasawa and colleagues actually repaired DNA by giving people oral and intravenous vitamin C. 2013, B vitamin supplementation is seen to show the atrophy of specific brain regions that are a key component of Alzheimer's disease. 2014, patients with mild to moderate Alzheimer's are given vitamin E, 2,000 units a day, and it slows the decline and doesn't hurt them. That same year, vitamin C was shown to greatly reduce chemotherapy side effects and improve cancer patient survival. 2015, vitamin C is shown to decrease the complications and length of hospital stays in intensive care unit patients. And in 2015, another large-scale study found a 26 to 55% risk reduction for pancreatic cancer in persons who consume more vitamin C. Imagine cutting the risk of pancreatic cancer by a quarter to half by taking more C. Pancreatic cancer is a very aggressive, very dangerous form of cancer. No cancer is safe, but pancreatic is particularly harsh. And just this year already, it's been shown that supplementation with vitamin C improves insulin-mediated glucose disposal in people with type 2 diabetes. In other words, people with type 2 diabetes that take vitamin C will need lower amounts of medication for their type 2 diabetes, and perhaps they'll be able to work off of it, or it could prevent the condition. And just this year, in 2016, other research has shown that antioxidants reduce aggressive prostate cancer risk by 2/3. And incredibly, the dose to do so was equivalent to a daily intake of only 1,500 milligrams of vitamin C. So if you've been told we need more research, maybe we should look at the research that we already have. This timeline of vitamin cures will seem almost unbelievable to you, and believe me, it'll seem even more unbelievable to your doctor. But the funny thing is, all this information comes out of journals that are published and read by doctors. If your doctor's not using high-dose vitamin therapy, you have an old-fashioned doctor. Let's help our doctors out. Bring this information forward. Let them learn nutrition. They didn't get it in medical school. It's time for us to make sure that they see all this evidence of how vitamins save lives. Remember, at dryourself.com, there's lots more information for you, easily searchable, free of charge. Check out my Facebook page, too, for The Mega Vitamin Man. And I hope you've watched That Vitamin Movie, because this is the first feature-length film ever on what we've just been talking about. And the best part of it is, the film's a lot more interesting than my simply talking to you about it here. And quite frankly, I think this is all pretty interesting. So I think the film brings it alive. Bringing alive health knowledge is a real good idea. consider the alternative to not having that knowledge. It's being not alive. We've got work to do. As long as we're breathing, there's something we can do. Tell your friends. Vitamins are not the problem. They're the solution. High doses of vitamins have been used by doctors to treat diseases, serious diseases, for 81 years. To print out a copy of this timeline, go to doctoryourself.com and you can select the timeline of vitamin cures and print it out free of charge. Thanks for watching. Take your vitamins and tell your doctor. Tell everybody.